Hi, I'd like to welcome you to this presentation on nursing informatics, the role of health information technology in improving quality measures. My name is Sharon L. Pabst, and I am a Fisher-Titus Medical Center training analyst for the Information Services Department. I'd like to begin this presentation by initially providing you with a little bit of information on the history of nursing informatics. Nursing informatics was first defined by the American Nurses Association as a specialty in 1992. The scope of practice was later defined in 1994, and then finally the standards of practice in 1996. The core principles of the practice of nursing informatics is that data and information are integral to the development of knowledge and wisdom. This concept will be explored throughout the presentation. The American Nursing Association has defined standards of practice which apply to the practice of nursing, including nursing informatics. The nursing process includes assessment, diagnosis, outcomes identification, planning, implementation, and evaluation. The nursing process is guided by the nurse informaticist in utilization of evidence-based practice, techniques in the collection and synthesis of data pertaining to workflow practices for process improvement. A diagnosis is identified and validated with consideration of potential risks to the consumer safety and opportunities for improvement. Measurable outcomes are defined specific to the identified diagnosis. A plan with prescribed strategies, alternatives, and recommendations with consideration of key stakeholders is developed and implemented. Evaluation of progress is achieved through the evaluation of defined goals that are performed in a systematic, ongoing manner, and information is documented and disseminated to key stakeholders with analysis and recommendations for policy and procedure changes. With the advent of clinical information systems, concepts have emerged that define the scope of practice of nursing informatics. Specifically, nursing informatics involves the synthesis of data and information into knowledge and wisdom. Specifically, data are discrete, objective entities such as documentation of a body mass index or BMI, off of an accurately measured height and weight. Information is data that has been interpreted, organized, and structured. Knowledge involves the synthesis of information to identify and formalize relationships. In reference to the example cited, knowledge is reflected in recognition that an elevated BMI in childhood is associated with increased risk for diabetes progression, and early warning signs of the development of sepsis that might go unrecognized by clinical providers can be identified by information systems that serve to alert the caregivers, all members of the team, to potential states of sepsis in the patient. As reflected in the example provided, knowledge is key to the successful management of patient care. The Foundations of Knowledge model depicts the ongoing relationship between the human experience and the acquisition, processing, generating, and dissemination of knowledge. Nursing informatics involves the integration of technology with vast sources of data that are synthesized into information that generates knowledge to assist in providing evidence-based care. Whether evaluating the compliance of nursing staff with documentation standards or educating providers on sepsis bundles for the management of complex care, nurse informaticists serve a key role in knowledge acquisition, processing, generation, and dissemination of knowledge to enhance the delivery of high-quality patient care. The American Nurses Association Code of Ethics states that the nurse's role is to promote, advocate for, protect the rights, health, and safety of all patients. One such right, as defined by the 1996 HIPAA Accountability Act, is that the patient's health information will remain private and secure. In the current age of the electronic health record, vast amounts of data in the form of patient information, such as demographics and insurance information, medical information, including health conditions and treatment regimens, and even genomic information, such as genetic studies and tissue assays, comprise what has been referred to as big data. As the scope of practice of nursing informatics indicates, data is the foundation of information, which enhances knowledge and the development of wisdom. A single piece of data on its own serves little purpose in determining its relevance out of the context of the patient care experience. As a key role of the nurse informaticist is to facilitate the development of knowledge and wisdom of those involved in care delivery by enhancing the integration of data into information that serves to enhance the quality of care delivered, reflected in performance improvement measures. The Centers for Medicare and Medicaid Services has defined specific measures to assess the quality of health care delivery in our nation with the goal of ensuring that care delivered is safe, effective, patient-centered, equitable, and timely. One example of a current CMS measure pertains to weight assessment and counseling for nutrition and physical activity for children and adolescents. Specifically, the measure requires documentation of body mass index percentile in all patients 3 to 17 years of age, once per year upon visit with a primary care provider or OBGYN provider. Based on BMI percentile, counseling for nutrition and physical activity must be provided. Core measures such as this are designed to improve patient outcomes. At the core of nursing practice is the commitment to promote, advocate for, and protect the rights, health, and safety of the patient. As reflected in the Foundations of Knowledge model, the nurse informaticist is in a unique position to facilitate, enhance, and promote the use of technology to increase knowledge. By recognizing the importance of safeguarding the privacy and confidentiality of all patient information and promoting practices that reflect this, the nurse informaticist serves to set a high standard of care. Additionally, by ensuring adherence to documentation standards that reflect compliance with measurable outcomes for patient care delivery, the nurse informaticist further promotes, advocates, and protects the rights, health, and safety of all patients. Thank you for joining me for this presentation. I hope you have a wonderful day.